every week now, so I thought I would start off a little bit about looking at the skin as far as certain places or certain areas on your face and what they would indicate if you had this condition. All right, so in Western medicine, we tend to look at the skin, and we tend to diagnose certain problems that the client might have. Whereas in Chinese diagnosis, they have a holistic look at the body, and certain areas on the face indicate certain conditions that we can look at. So the first thing that we're going to look at is you can divide the face in 3 areas. And basically what they say is that the top area, the forehead, this shows our intellectual nature. So the largest, if you had to divide your face in 3, the largest area on your face would indicate what type of a person you might be. Okay, so the forehead, if you have a very large forehead and that's the largest part of your face, that would indicate that you have an intellectual nature. So those are people that are more inclined to do jobs like being auditors, etc. If you go to the middle half of the face, and your middle half of your face is your largest part, then you tend to have a more of an emotional nature, and the bottom part, which indicates the strength of will. Let me just have a look. So the bottom part would be the tip of the nose to the chin area. So whichever part is largest. All right. So that would indicate have an indication of what type of person you have. If you have a balanced face, which has all 3 of them, is very, very uncommon. And normally these have an intellectual development, emotional awareness, and strong will. And they have a philosophical turn of mind. So let's look at the different areas on the face. Let me just get my notes, sorry. All right, so by studying certain skin conditions and changes, we can actually determine the inner imbalances and the stressed areas in the body, which could give an indication of, and this is not to say that if you have this problem on your face or on your skin, then you definitely have this condition. But it is something to look at, and there is really some method in the madness. So because each area of the face is said to relate to an internal body area, disharmony in that internal area can actually be seen when we do skin analysis in a skin salon, and we look at the complexion, the texture, the moisture of the skin. That would all indicate a certain condition that we look for usually. So the forehead part is linked to digestion, which means that your upper forehead is linked to your bladder, and your lower forehead to your intestines. So should you have any breakouts in your upper forehead, then that would usually indicate you might have a problem in your bladder. And also these indications could also be which hereditary. In other words, it could have been something that your parents had experienced while you were not even born yet. So it's not necessarily always an indication that you have a specific problem. So please don't rush to the doctor and say that I've said that you have some or other condition that needs to be treated. All right, so the lower forehead, as I said, intestines. If you have any congestion in the specific area, the lower intestines, then we tend to look at our elimination. Is the client constipated? So if you suffer from any of those, then you should suffer from a bit of congestion in this area as well. The eyebrows, or basically, if you have coarse hairs on the eyebrows, then this indicates adrenal stress. We all know that the adrenal glands are found on the kidneys, and they are responsible for basically secreting over 40 hormones that are responsible for fight and flight. So if you have coarse eyebrows, in other words, if you feel over the eyebrows and they're quite coarse, and you tend to have maybe a little bit of hair growth on the side of the face here, you might have breakouts on the chin as well, then it might indicate that you've had long-term stress or a very traumatic condition, or something might have happened. These are all related to hormones, which they need to obviously be checked as well. All right. So your adrenal glands are definitely linked to stress. And the next time I speak to you, I'll give you an indication. Today is Tuesday, so I will be doing a live. I'm going to be trying every week on a Tuesday in the mornings, so that you can watch that on live, or you can watch it in the evenings as well. So I will be, in my next talk, I will be talking about stress a little bit more and how that impacts on the skin as well. All right, so the eyes, in Chinese medicine, the eyes are linked to the liver. And the liver and the eyes are sister organs, which means that if you have little liver lines, in other words, if you have a line on the inside of the brow here, that would usually indicate that you have liver lines, what we call, and you might suffer from very sensitive eyes, sensitive to light. You might be wearing contact lenses. You might have a pear-shaped figure. You all know what a pear looks. So it means that you've got a thin upper body and a rounder bottom area. You might even have little, if you look at the knees, the inside of the knees, you might have a bit of cauliflower knees. So those are those nice rounded knees on the side with little humps in them. And then you might have broader hips. Those are all indications of liver lines. And as I said, the eyes and the liver are sister organs. The eyes are definitely linked with the liver. So if we look at the inside of the eyes, if they are very yellow, then obviously there are definitely yellow eye problems. Are the eyes set up wide apart? Are they close together? Eyelid allergies. So if you have eyelid allergies, then they are linked with allergies and lung stress as well. Under the eyes are linked to the kidneys. So if you have puffiness or darker circles under the eyes, then we need to improve our water intake very definitely, and we need to look at our lymph drainage, because that is usually an indication of that as well. Grittiness, if you feel over the eye at the bottom and it's a little bit gritty, it could also indicate an excess of uric acid as well. So if we look at the nose area, naturally large and open nostrils indicate very strong lungs. Smaller or flaring nostrils indicate that you have lung stress. So you might be a smoker, or you might be somebody that suffers from lung problems, asthma, things like that, allergies, and numerous comedones, and oiliness over the nose area could also mean that you are prone to colds and to bronchitis. Redness and broken capillaries on the nose area, and puffiness over the nose, if you've got a puffy nose, would usually indicate that you're also prone to allergies. And then also respiratory stress and sinus problems, and you may even be very sensitive to hay fever or to people smoking around you. All right, so the cheeks are linked to the lung area. So broken capillaries, those are those little red capillaries that we sometimes see on the cheek area. It's not really broken, it's just dilated, but they cannot go back to their natural strength anymore, so they tend to stay dilated. So some people call them broken capillaries. But those little capillaries are fine little capillaries that indicate lung stress, and allergies and sinus congestion. If you have comedones, those would also indicate that. Pustular breakouts in line with the teeth, this area, may also indicate sinus or gum problems. If you have in the lower jaw area here quite a bit of breakouts, then we tend to ask the person if they still have their wisdom teeth, if they have any infections in their teeth or anything like that. Okay, so the mouth, cracking and dry lips are linked with stomach or gastric stress. And the upper lip links with the stomach. So a turned upper lip indicates stomach acid, indigestion, or a nervous stomach. It might be somebody that is not able to actually show their emotions, and they keep all their stress in their stomach. The lower lip links again with the large intestines, and a pouty full lower lip links with constipation and poor elimination. On the chin area, this links with your reproductive area or your reproductive organs, and breakouts in this area are often associated with menstrual cycle in women. So microcomedones are often present at the side of the chin area, here on the sides, and they may erupt into little papules just before your menstrual cycle. So that is all about your more or less just a quick overview of the face. So if you have puffiness, let's just go back to the eye area. If you have puffiness under the eye area, then again, as I said, take in more water, and you need to look at your lymph drainage. And if you have papery eyes, in other words, those are the people with extremely fine skin under the eye area, very almost papery thin eyes, then it also means it could be that one of your kidneys are not working and that you are dehydrated. Right, so those are some of the things we look at. Dark circles under the eyes could be a lack of oxygen in your blood. It could be tiredness. It could link back to anemia. So have your iron tested. If you're somebody that use laxatives, that could also indicate dark circles under the eyes. Or if you had a blood transfusion somewhere in your life. Okay, at the tip of the nose, just quickly, the tip of the nose, if it takes about 7 years to change the tip of the nose. It's very interesting, but if it tends to twist either to one side or to the other side or up, it would indicate back problems, or you might have been in an accident with whiplash. If it goes to the left or the right, it could indicate the side of the injury. Very interesting. The face and the body are just absolutely amazing. And then just going back to the eyes, if you look at the eye, your right eye your left eye links back to your mother, and your right eye links back to your father. So if you have any problems in a specific eye, it could link back to something that your father or your mother might have had. All right, so I'm not going to go any further than that. Also, as I said, if you've got a little horizontal line over the nose area, it could indicate pancreas problems. You might have a very sweet tooth. Then people in your family might be suffering from high or low blood sugar. And if you have a little line in the earlobe, it could be an indication that you might someday become a diabetic in the future. So things to look at. Okay, so I think I've done most of it. And yes, that's me for now. Have an awesome day. If you've got any questions, comment below and feel free to share this video. I'm going to be doing a lot of training like this. I just think I've got a lot of information that I'd like to share with you guys. It's interesting. Some of it might be interesting. Some of it might give you some more information to use. And yes, I hope you have an awesome day and see you soon. Bye.